Hello, and welcome to another episode of the CIRS Group podcast. I'm Barbara,
And I'm Jacie.
and today we are talking about tick-borne stuff. And it's very appropriate, although just at the tail end. May is Lyme Awareness Month, Lyme Disease Awareness Month officially, according to IGeneX, whose sole purpose is to sell tick-borne tests. So take that what you will. It's good promotion. But yeah, we found that out. And also, I have my own tick-borne testing story to share a little later in the episode. Yeah, we thought this would be a good opportunity to bring our own extra bit of awareness to this topic for you guys, since unfortunately it seems like Lyme and other tick-borne illnesses have a very high prevalence for happening right along with CIRS, higher than I think we might have realized or thought in the past. Certainly me, I'll speak for myself. So, before we get into it though, of course, please don't take any of this as medical advice. Always consult your practitioner or seek out a Lyme focused practitioner, someone who really knows their stuff on that. And if, we'll get into that more later in the episode as well, to consult about what testing or treatment or any of that stuff is right for you. So we are not doctors. Go find a doctor.
So the reason that a lot of CIRS patients might be aware that Lyme and tick-borne is relevant to us is when you got your HLA tested to get diagnosed with CIRS, you may have noticed that one of the CIRS genes is specifically for Lyme tick-borne. So it is one of the biotoxins that CIRS patients can be susceptible to.
Yeah. And I think what's weird about tick-borne stuff in general is there's so many things. One, you may not know that you've ever been bitten by a tick. There's lots and lots of people who end up testing positive for one of the tick-borne illnesses and have no memory of a tick ever being on their body. And maybe they don't even live in the really densely populated tick country, and so they think they're safe. But it turns out there are tick-oriented illnesses, tick-borne illnesses in actually all 50 states if you're in the United States. And it's obviously happening internationally as well, different strains in Europe and Asia. But point being, it's a sneaky one. And so we're going to talk, we hope that by the end of this episode, you have a little bit more of an idea of what the Lyme and the tick-borne illness symptoms look like and how similar they are to CIRS, but also how they might be a little different too. So if you seem to fit one of those profiles, it might give you the information you need to pursue testing and to rule that out, hopefully, for yourself, or rule it in and realize that's some more healing you have to do. So, for a lot of people, basically, there's two different types of ways that Lyme and tick-borne illnesses manifest. You can either get like an acute infection, like you get bit by a tick, you within 2 weeks, you have a fever, you have a rash, you have all these symptoms coming up. And if you are aware enough to know that, oh crap, I just got bit by a tick and now I have all these symptoms, run to some place that can treat you. Because if you can get treated in that acute stage, that is better and your odds of improvement will be quicker if you are able to tackle it quickly in that way. Unfortunately, for many of us, especially by the time we have developed CIRS and everything else has happened in our lives and the symptoms start to accumulate, what you are looking at is unfortunately more of a chronic case, a long term, you got bit a long time ago, and now you're dealing with the ramifications of it later on. It's still treatable, it's still something to tackle, but it's those are the two ways people tend to come into problems with tick-borne illness.
So chronic infections can include a couple of different types. The first one, and I think the one most people would be aware of, is Lyme. So it's caused by Borrelia burgdorferi, just kidding, burgdorferia. It's a type of bacteria carried by tear ticks, and the symptoms can include internal earthquakes. We talked about this a few episodes ago. It's like when you're laying down at night, you just feel this internal vibration, and you think, is there an earthquake near me? But no, it's you. Shortness of breath, radiculopathy. What is that?
Radiculopathy is like nerve pain, like
Okay.
numb. And when I say nerve pain, that can include numbness, tingling, especially if it moves around and isn't always in the same spot. That's something that can be caused by Lyme.
facial palsy, frequent headaches, joint pain, fatigue, brain fog, rashes, fever, irregular heartbeat, joint pain and swelling, cognitive issues, which include ADHD-like symptoms. So you'll notice when we're saying these, some of them overlap with the CIRS symptoms, the CIRS symptom clusters, but also some of these are more unique to Lyme and tick-borne.
Yeah, and as we continue through the rest of the tick-borne illnesses, there's some of them are pronounced in ways that we may not be as familiar with because we do a lot of reading on this, but don't always hear them said out loud, like Borrelia burgdorferi. That's not how I've heard it said, and I've heard it said with confidence. That what I just did is not it. But we can put these in writing in the description so you guys can like Google the actual thing without wondering how the heck it's spelled.
Except for
So,
me, I'm only going to call it Borrelia Burgdorf-Goodman now.
yes, I support that completely, and I will always know what you're talking about. Another common tick-borne illness is Bartonella. Now, this one is surprising to me. I learned this relatively recently, believe it or not. It's primarily associated with fleas and lice. So this, though it's in the category of tick-borne, I don't know about you guys, but I had pets growing up. Fleas weren't that weird. We don't worry, I didn't live in flea living conditions all the time, but that happens. When you have dogs or you have cats, it just happens. And then you treat them and you wash things and you think that's fine. But apparently that can also, they can transmit Bartonella. And Bartonellosis is the actual illness. It can cause the cat scratch disease or cat scratch fever, I think it's sometimes called, and trench fever. Symptoms of Bartonella oriented things include fever, swollen lymph nodes, fatigue, headache, skin rashes, joint pain, headaches, peripheral neuropathy. That's the like burning sensation and numbness, a numbness really in your extremities, cognitive impairment, anxiety, and GI issues. So again, a lot of similarities with Lyme, but then a little bit different, a little like sliding over a little bit on the symptoms list. But yeah, there you go, Bartonella.
And Babesia, or babesiosis, is caused by microscopic parasites, yay, that infect red blood cells. It causes flu-like symptoms as well as fatigue, loss of appetite, air hunger, confusion, and sometimes seizures. Ew. And more severe symptoms like hemolytic anemia, which is the destruction of red blood cells, jaundice, which is the yellowing of skin and eyes, typically associated with liver issues, and organ failure. So that sounds like a good time.
Yeah, and so that we're not listing off a million symptoms in a row, we'll summarize the last few just by referencing them. Tick-borne relapsing fever, or TBRF, anaplasmosis, Ehrlichiosis, and rickettsiosis. They are a little bit less common, but they are still potentially something you may be dealing with if, again, you have had CIRS, you've been treating it, and you're not quite there on your healing. These are any of these symptoms, if they are persistent, or even if they come up later on in your CIRS healing journey, they just start popping up more, and you should be getting better. Everything else is indicating you should be getting better. That I think this is a good indication for looking into tick-borne illness.
Just really quickly, the reason why they might pop up later in your CIRS treatment is because your immune system is coming back online. And so suddenly your body is able to react to things like tick-borne and Lyme. So it's not uncommon. In fact, I would say it's more common for CIRS patients to find out about the tick-borne Lyme piece later on in their CIRS protocol.
And I hope anyone who is experiencing that can have somehow find hope in that because it is like peeling away layers of an onion. And yeah, it's stinky and it'll make you cry. But at the same time, every layer you had to get through CIRS and CIRS treatment in order to get to the point where your immune system is online and able to handle another infection and deal with it in the proper way. If you haven't already, definitely go back and listen to our episode with Dr. Peg DeTulio. She is definitely a great tick-borne illness expert in addition to CIRS, and she talks a little bit more about the intricacies of all of that and why it is in her opinion, and everyone has different schools of thought, but in her opinion, it's important to treat the CIRS first to get your immune system online, and then you can tackle the tick stuff when you are ready.
So how do you get tick-borne illnesses. So I think the obvious and most known answer would be you are bit by a tick. But there are plenty of people who have no memory of being bitten by a tick who might have Lyme and tick-borne. So it's important to know that's not the only way you can get it.
Yeah. Another way, which I've experienced, may or may not have been the cause of my situation, is being bitten or scratched by a cat. I love cats. I especially loved them as a kid when I was less allergic. But they like to, even when playing, they tend to scratch, right? Like I've had cats, I loved them very much. They loved me and they scratched the crap out of my arm while playing. Maybe they weren't the problem though. I've certainly been known to pet stray cats and sometimes they're just like, oh, I like being pet. I like being pet and bite because that's what cats do. So that could be another possible way of getting, especially Bartonella specifically.
And then, as Barbara already mentioned, fleas are another way, but also mosquitoes and other virus carrying insects. So, another reason to move to Vegas where there are no insects.
It's pretty nice here, guys. We have a limping bee population, perhaps, and that's about it. I know, I hear we have scorpions. Knock on wood, I still haven't found one. I don't want to find one in the universe, but anyway, at least scorpions I don't think have tick-borne illness. But
Because
let's,
ticks are an arachnid.
I
So, I'm thinking
know.
like scorpions, spiders, do they count too?
Oh man, let's pretend I didn't say that. All right.
Okay.
And then I guess another surprising way you can get it is actually from your mom at birth. This was news to me as well. So yeah, that's something that is a possibility. So even if you've been relatively safe and not around cats or dogs or fleas or ticks or anything like that, if your mom may have had tick-borne illness, that can be passed down when you are born.
So, who is at risk of getting Lyme and tick-borne? The number one is if you're in an endemic area. So, that would be the Pacific Northwest, the West Coast, the Northeast, and parts of the South and Texas. Apparently, there are different strains in Europe and Asia, but there as well.
Of course, anyone who spends time outdoors, which theoretically is everyone, but especially if you happen to live near a forest, if you're into gardening, or if you're a landscaper, for example, kids that play outside, apparently little boys are more prone to get bit by ticks than little girls, just because they tend to enjoy playing outside more than girls. Not
I
to
really thought you were going to say because they tend to F around and find out more than girls.
that too. And then, of course, if you are an avid camper, hiker, or even if you are a golfer, although my boyfriend, who is a big golfer, pointed out that you have to be pretty bad at golf for that to be a problem because that means you are shooting it, is that even the right word? Hitting it out into the taller grass areas that you shouldn't even be playing on. If you're that bad, then those are the people who are likely to get bit by ticks because the main fairway is probably pretty well maintained. He's just being a jerk saying that, guys. I don't
So,
even know why I
specifically,
repeated it.
people who are bad at golfing,
That should
go
be on
get some lessons. So, then how do you test for tick-borne Lyme? You have a few options. So there's the CDC test through Quest or LabCorp. It is prone to false negatives, but is often covered by insurance. So I think in the Dr. Peg episode, she said if insurance covers it, she just adds it to every blood draw. And that way, if you do get a couple of false negatives, hopefully it catches it eventually. But it's testing for the Lyme disease antibodies, IgG and IgM, and immunoblot.
Yeah, and the reason that you'll get a lot of false negatives is it's very strict on what bands show up on the immunoblot as to what they'll consider is actually Lyme or tick-borne illness, or Lyme in this specific case. So the other tests that we're about to talk about are much broader in what they allow to show as reactive and how many bands and all this stuff. And if this sounds weird to you, this is not necessarily something you need to worry about. Your doctor can interpret your test results for you when you meet with them. But I just want to let you guys know why the CDC standard one, the often free or cheap one, unfortunately, is just so strict that it's going to catch very few actual cases. And if you get a positive on those, then you can really take it to the bank. But that said, you may be missing an infection if you are only relying on that kind of test. So the gold standard is by a company called IGeneX. Most Lyme or tick-borne practitioners prefer that test. It is pricey though, and it is not covered by insurance. I believe the price is around $1,000. And so, again, it has those broader requirements for positives. So it's going to catch more. It's more likely to catch the chronic or hiding Lyme infection as opposed to an acute or active infection, which is what the CDC test will probably catch instead. But the happy medium between those tests is the one by MDL or Medical Diagnostic Laboratories.
That sounds so generic.
It really is. Yeah, it's not like cool, like IGeneX. Like that's like
It'd
trade.
be if LabCorp was like blood work laboratory. Well, I guess it is. It's Laboratory Corporation, LabCorp.
Yeah, it's not exciting, guys. But the nice thing about MDL is they do follow more broader requirements like IGeneX does. And they are often covered by insurance magically. And even if they're not, they're about half the price of IGeneX. So the reason, yes, maybe it's not as perfect of a test as the other one. And by the way, no Lyme or tick-borne testing is perfect. So I should really rephrase that. But even if it's not as good, at least it's better than that like CDC base level one is. And then also with MDL, for the same price of one IGeneX test, you can test yourself twice. And so that's helpful because, as we're about to go into more, the problem with Lyme and tick-borne illnesses is they are cyclical. They show up and then they hide, or they flare up and then they go away. And so oftentimes you will need to test multiple times to even catch it in the first place. And even if you do catch it, you probably want to test again to confirm and make sure that was not a false positive either. So there's a lot of just retesting involved in this process, which I know sucks, but at least MDL offers it at a slightly lower price. So it's a good entry point. And then you can always, once you get confirmation there, you can bump yourself up to the IGeneX, knowing you have more confirmation that this is likely a problem for you, and therefore your money will be better spent.
And if you're listening to this and thinking, isn't the Genie and NeuroQuant, aren't they supposed to identify Lyme? Kind of. They might identify acute Lyme, but they will not identify chronic Lyme, which I would say is what most CIRS patients who have Lyme or tick-borne are experiencing. And it won't catch the other tick-borne infections. So it is unique to acute Lyme. So unfortunately, unless you have the acute Lyme variety, it's unlikely that you would be able to identify it on the Genie or the NeuroQuant. Now, there might be signs on the Genie and NeuroQuant that point to you needing Lyme testing to confirm, but it's not going to be a conclusive diagnosis, and you very likely will need to do MDL or IGeneX as well.
Yeah. And examples of the signs, which are not necessarily definitive, so don't take this to the bank, but at least in my situation, a very particular part of my brain was inflamed called the thalamus. That seems to be an interesting link with tick-borne illness. Did I have a high Lyme score on my NeuroQuant? No, I did not. But I did have those signs that a trained person can interpret when they're reviewing my NeuroQuant report and can potentially identify that I might be at a higher risk for tick-borne illness issues. So, why not get into my story of testing? So, when you do the tick-borne test, you do need to wake it up in your body. And the reason for that is tick-borne illnesses. I wish there was a quicker way to say that. I've said tick-borne illness so many times in this episode.
You can't say TBI because that's a traumatic brain injury.
Yeah, we're stuck with it, guys. It's okay. So, the illness, the little organisms, they will go into your cells and bury themselves, first of all. They will form cysts around themselves and biofilms to protect themselves from attack. And they will mutate to avoid being attacked when they feel attacked. This is a tough little bugger to deal with. So I just want to acknowledge that first and foremost. Therefore, as far as what I was told to do and how I have done it, I did go through CIRS treatment. I'm passing the VCS test. Some of my symptoms have resolved, but I have stalled, and I don't know why. So now I'm in that process of ruling things out. I've done lots of different tests that I won't even get into because that's not what we're talking about today, but I've ruled out a lot of other things at this point. So now tick-borne is on the table. What I needed to do first was take some herbal drops specific to tick-borne illnesses. Your doctor may have a specific one he or she wants you to do, so I'm not even going to say which one it is. There's lots of herbals on the market over the counter that you can look into, but please do this with the supervision of your practitioner. I will explain why soon. So I started taking the drops, and you start very slowly, one drop in a whole glass of water per day, and then you increase that to two, three, four, blah, blah, blah. For my particular formula, the full dose was going to be 15 drops twice a day, two different glasses of water at two different times of day. I, at one point, like I normally am, became impatient and jumped from 7 or 8 drops twice a day to the 15 and 15. And I lasted on that for about 1 week until I had some pretty severe GI issues and pain, pretty severe fatigue, and my anxiety was off the charts. And I couldn't, for a second, I couldn't figure out what was the problem. Sometimes I have all of those problems randomly just because CIRS, but they all culminated. And then I realized, wait a minute, this might be because of the stupid drops. That sucked because that means I probably have a tick-borne issue. That's my interpretation of that. So I stopped the drops and I let my doctor know. And sure enough, all of those symptoms resolved. So then I got tested, the blood test with MDL, as quickly as I could after that, which was, I think, in about a week. And I did test positive for Bartonella and Lyme. One note about getting tested, this is one of those tests where you, at least if you do it through MDL, you will get shipped your little vials to collect your blood. You would then go to the type of lab that will allow you to take your blood with you, or if they're very nice, they will handle the shipping of the samples to MDL for you. And that's what they did for me. Now, I say that because the normal labs like Quest and LabCorp do not do that. They won't handle anything special. So, two chains of labs that I've heard do this are either Any Lab Test Now. Yes, that's the name of the place, or Clinical Pathologies Labs. They're a little bit less national, but they are great and they're here in Vegas, so I really liked using them. So, another thing that you may want to do at the same time of sending off that test, shortly thereafter, it would also be a good idea to get some other inflammatory markers tested to see, is your body in this state of inflammation now as a result of all the things that are the tick provocation drops and the test. And depending on what your test results are, it'd be nice to get a feel for where your normal CIRS blood markers are at the same time. And that will help confirm or deny infection as well. And then, yeah. And so I got the results back and I got positive. That's the first time I've tested for tick-borne stuff, guys. Maybe I've done the CDC one along with CIRS blood work early on and it was negative. But that was like the first like official tick-borne test I've done and I have it. So if I had gotten a negative response or result, I probably wouldn't have trusted it because it was really weird that I had some like Lyme-ish and Bartonella-ish symptoms kicking up in me at the same time of provoking it on purpose. So I probably would have waited a couple weeks and then redone the test if I had gotten nothing but negative. But because I have some positive results, I'm going to take that as fact and probably now transition into treating Lyme and Bartonella from here.
So a good thing to talk about would be like, when should you consider testing for Lyme and tick-borne? So as we mentioned previously, when you get to a certain point in the protocol, your immune system is becoming more regulated again, because that's what CIRS is, chronic inflammatory response syndrome. It's an unregulated immune system, which means it's not reacting to things the way that it should be. So when you find enough of the mold, actinos, biotoxins, and you've recovered enough that your immune system is coming back online, that's when you may experience a stall in your healing. And you might start experiencing these new symptoms that are more related to Lyme and tick-borne. So if you test at this point, because your body is now able to fight the Lyme, you're provoking it on your own. So you're more likely to get a positive result. But again, make sure you work with your provider, do the provocation protocol. That way you have the best chances and you're not throwing $500 at MDL every 3 months or whatever.
Yeah.
So because those tests are testing for your antibodies to the Lyme, you want to make sure that those antibodies are present. So do the provocation protocol, get the results that you need to move forward with treatment. But another sign that you might want to look into Lyme is if you have cyclical symptoms, because Lyme is cyclical. So you may be fine for 2 weeks, and then you may be not fine for 2 weeks, and then you may be fine for 2 weeks, and then you might be not fine for 2 weeks. And that would be another really great sign that Lyme tick-borne is something you might want to look into.
Yeah, really great point. So, how do you treat it? We're not going to go into huge detail here because really this is the part where you need to find a practitioner that works for you, with you, preferably knows about CIRS and Lyme. Some people go for one doctor for each, one doctor that does CIRS and one doctor that does Lyme. It depends on the openness of your CIRS doctor and again, their expertise. You do want to work with someone who has knowledge and experience with Lyme and tick-borne illness rather than go with someone who maybe has helped a couple people with it, but doesn't really focus on that. You want someone who knows what they're doing, is the point. From my research so far, there's really two main ways to treat it, and that is either the herbal route, which is basically more of those drops that I already talked about taking on the provocation side, or conventional antibiotics. There may be other methods out there. There may be supplemental therapies. I know some people will also focus on supporting their immune system as much as possible because you are basically trying to help your immune system fight it off as well as kill it. It's a little bit of a different plan of attack than CIRS, right? Because in CIRS, you don't really, your immune system's kind of like, I can't do it. I don't know how. But in this situation, we're hoping that helping the immune system as much as possible is going to help kick it into gear and help the process along. So, yeah, that's probably what you want to look for. Chances are it'll be like a functional medicine doctor, holistic doctor. It's probably not going to be a conventional doctor, unfortunately. I say unfortunately because conventional doctors are covered by insurance and unconventional ones are not. But this is very important to address. It does cause damage in the body over time. It is important to treat sooner rather than later. That is not said to scare you. It's just said to state the fact that it is an important thing to take care of. Not like if you can muscle through pain and oh, I don't notice when I have GI issues. I have normalized it. I'm just getting old. The danger of that is it is being destructive. And so you want to pause that and preferably heal and repair that so that the rest of your life is free of these crazy symptoms and pain and all the other things that come along with it. And I would also just add quickly, I have run into some pseudoscience type practitioners in my just researching what do people do about Lyme and tick-borne, and be careful of that. If somebody's charging you $25,000 for sitting in a foot bath once a week, like for a year, mind you, I don't do that. That's probably not enough. I shouldn't say that. Maybe it is. I don't think it is. Just be
Show us the
careful, guys.
data, show us the research.
Exactly. Show me research. If this ionic foot detox bath is going to do something for me, just give me some clinical studies with control groups. That's all I'm asking for. And I hope you ask for that too.
And I know that a lot of people in the CIRS group have had to take the Lyme tick-borne rabbit hole, and a lot have seen improvement from addressing this piece. And it's an interesting thing because we've had the group for 3 years. Yeah, the CIRS group is 3 years old, guys. And we've seen people have these radical improvements and then they hit a wall and
Mm.
then they figure out the Lyme tick-borne thing and then they just keep progressing. And it's so cool to see that journey happen. And our hope in recording this podcast and sharing the information is that when you hit that wall, you don't spin your wheels for as long and you're able to pursue the things that are most likely to be present as quickly as possible so that you can heal as quickly as possible. So if you want to see those stories, definitely check us out over at thecirsgroup.com for more resources and support, clinically backed, preferably. We're
Always.
Yeah, we're sticklers for that, aren't we?
Yeah, it's kind of annoying, I'm sure, to some people.
The people with affiliate codes with the non-research based things.
Uh-huh. Yeah,
Yeah,
those
those
people.
ones. Those ones. All right, guys. So for more resources and support, join us over at thecirsgroup.com.
We will see you there.